We have really a diversified background over here. We have Akshay sir from Ericsson, and he has been a telecom communication professional from last 20-22 years. Then we have Sheenu ma'am, who is from Apex Hospitals. Then we have Dr. Varun, who is working on this COVID thing. And then we have Shesh sir, who is one of the biggest co-working space players in Bangalore. And the most important, we have the moderator, Sumit sir, with the company Heads Up Corporation, which is into HR. So please, over to you. I feel this is the most important session, particularly for me, because I am into co-working spaces and I would love to take the insights from all of you. So please, Sumit, over to you.
I'm audible?
Yeah, yeah.
Okay. So I think the first thing of the entire hygiene issue really starts with the namaste. So namaste to everyone, and especially the panelists and all the attendees who are here on the Sunday afternoon. And I know it's just post lunch, so it might be little, you might be feeling little out of place, but we really hope that will work out great for everyone. And so I just thanks Himish to invite me on this platform as a moderator. And I'll just give a quick introduction about myself and my fellow speakers for this particular session. I'm sure everyone knows the session by now. The session is primarily focused on workplace hygiene post the lockdown period or post whenever things start getting normal. Now, the first person I'm introducing is Mr. Akshay. He is a telecom professional with almost 25 years of experience in mobile networks. He has previously worked in Ericsson and has done exhaustive work on modernization and 4G implementation across Rajasthan. Our next speaker is Dr. Varun Mathur, who is a general physician and a nodal officer in RRT team for COVID in Rajasthan. Our third speaker for the session is Ms. Sheenu, who runs a set of hospital chains, which is under the name of Apex Hospital. And our last speaker is Sheesh. Sheesh is the co-founder for one of the biggest co-working spaces in Bangalore. I think we are just waiting for Sheesh. If you can just contact him once. I think he is not joined in till now. But so she says has got almost 14 co-working spaces in Bangalore, which makes it one of the biggest co-working spaces in South India.
Hey, I've been.
Oh, you're there. Great. All right. Sorry. Okay. So all right. So I'll just start with my small introduction. So I am Sumit. I have my own human resources startup, which is with the name of Heads Up Corporation, where we work with multiple Series A, Series B, different kind of SMEs in helping their entire human resources system, starting from the scratch, going into different verticals like compensation, rewards, to go about talent acquisition. And that is how we help in the human resources part. So we are typically the human resources partner for any startup. We have got multiple startups we are working with. For example, SmartWorks is another co-working space, so probably she should relate to that. Then we have got Mama Earth, which is into personal care. And then we have got a lot of organizations which we work specifically in infrastructure sector, which is also called as EPC segment. That's about me. I will pass on the mic and I would request our first speaker, Mr. Akshay, to really start with your experience and let's just kick off with this. Yeah.
Thank you, Sumit. I think I'm audible to all, and it's a very nice opportunity that has been provided by Himish. I'm really, very happy to support this cause which he has taken up, and it gives me real pleasure to interact you people from industry, which is not of my domain, but still you are interrelated, and precisely after this COVID, you will be the people who will be driving us, and you will be providing the support which is required by us. So let me give a brief introduction of mine. I am a telecom professional, BTech in electronics and communication from, which is now RTU, from Government College Kota. And I started my first mobile professional career with Oasis Cellular, if most of you people will remember. I am the founder member of Oasis Cellular. That is the very first mobile call of Rajasthan. So from that day, I am working in mobile networks. I worked with Nokia for 8 years, and now it is almost 12 years with Ericsson. So this is my second time with Ericsson. First time it was 2 years, and then again now continuously for last 8 years, I'm working with Ericsson. Presently, I'm working from Jaipur. I'm responsible for operations as well as project deployment, which is the 4G network upgradation, which is we are doing for Vodafone and Bharti over here. So particularly, I'm looking after the Bharti operations right now on the project deployment. 4G, you know, all that it is mainly data that is booming now. And after this event, it has gone to petabytes of uses. So this is the small introduction. Looking into the opportunities that we have in hand as a telecom professional, yes, there is business that is coming to us because now we have found that there are pockets. Looking into since we are locked down, most of the traffic is shifted to the household, RWAs, residences, and the working places or the office places are currently, are under lockdown. So the traffic has shifted, and to adjust to that traffic requirement, it is very difficult unless and until you have a very good tools in hand where you can, predict how the network will react. At the same time, the industry demands that it should be 5 times 9 of the network availability. Now, when I say 5 times 9, it is 99.999. This is the precision level. But the TRI recommendations say that at least you should be close to 99.99. So currently, if you see, all networks are running at 99.9798. So this is the level of availability currently the telecom professionals are working so that you people are able to work and enjoy the internet sitting over here. And this is how we are now interacting through the internet. So this is how the telecom people are working day and night. So it's an essential service like yours. There are doctors over here. So we are doctors of the network. That's why you are able to, connect. Precisely in telecom, we have got 3 modes of operation. If you see, we have a NOC, which serves globally. So not only India, Ericsson serves African networks, American networks, sitting here in Noida, in India. At the same time, we have some deployment redundancy built up in Gurgaon, Gwalpadi. So Ericsson is not only serving India operations, we are serving global operations also at the same time. So our people know that under the global lockdown, how people are. So currently, we cannot deploy many people to the offices. So they are working from home and they have to be connected to the global networks. So level of network availability, which is required in this case, the hygiene which is required in this place, it is tremendous. If you look into the volume that we are operating. Now coming to our requirement, the question comes up once we are away from this COVID, how we are going to interact. So that we'll be discussing during our course of discussion over here. So precisely to give you more flavor so that in the due course of our discussion, you can give me some solution because there is a crisis management team which has been deployed in Ericsson Global and Ericsson in India. We are defining rules and regulations, how we are going to act once we are away from this lockdown. Okay, so this will help me to carry your thought process also to my company, which we would like to deploy and implement in India. So over to Sumit, and later on then during the course of discussion, I'll give you more inputs on that. Thank you, Sumit.
All right. Thank you for your insights, Mr. Akshay. I'm sure 4G is going to be a savior for a lot, because a lot of us are really working from home, and data consumption, I'm sure, would have spiked up and it's going to be even more crucial in the coming days. Now, now we have got two doctors who would be speaking on the topic, uh, which we all know. So I'm passing it on to Dr. Varun Mathur, and Varun, you can start. Thank you.
Hello, I'm audible? Okay. So firstly, Corona Namaste. Corona Namaste to everyone. So the time of hellos and highs have gone back and the new Corona Namaste is here. So firstly, Namaste. I'm Dr. Varun Mathur. I'm a general physician. I'm also the nodal officer of the RT team in Jaipur, Rajasthan. My topic, I'll just be a little clinically and technically telling you all about the coronavirus, the COVID-19. This virus is actually is a group of related viruses. It attacks the mammals and birds both. In mammals and humans, it attacks the respiratory tract. So it can cause upper respiratory tract infection. It can cause pneumonia. It can cause fibrosis of lung. So these are the major, the things it can cause, and it's quite similar to the viruses that came in 2002, which was SARS, and in 2010, the MERS, the Middle East Respiratory Syndrome. So it's quite similar to that. It has like around 96 to 97% genes similar to those viruses. So in India, the first case came at around 30th of January. I'd like to, tell about the symptoms. Firstly, it has three primary symptoms. The first or second day of the disease, you'll have fever, mild fever, or maybe high-grade fever. Then on the third and the fourth day, you might have dry cough. And the fifth and the seventh day, the time you start, feeling difficulty in breathing, you have dyspnea symptoms. So these three are the main primary symptoms, which if we have a patient in front of us, and if the patient have these three symptoms, we try and get his COVID test done. Some may be asymptomatic, some patient may be asymptomatic. They might not have, like a patient in Jaipur, Rajasthan. He was a resident in anesthesia department. His sample was taken and he found to be positive. He was not having any symptoms at all. So you may be asymptomatic as well. This virus is extremely virulent. It's extremely aggressive. It can travel from one person, and the one person can give it to maybe hundreds of patients. So in Italy, there was a situation that a female lady, she was 60, 70 years lady, and she went to a social gathering. There she spread to around 1,000 persons. So it is a very virulent virus. So it can travel very quickly. It all actually began in the wet animal market of China. And now it has affected around 210 countries and territories around the world, as according to WHO. The treatment, there's no official treatment yet. We are still waiting for the official treatment yet. But a lot of, clinical trials are going on in the treatment. In SMS in Jaipur, in Rajasthan, the team of medicine, the doctors of medicine, they gave a combination of, medicines to the patient who came here. We have around 1,500 patients of corona in Rajasthan right now, and we all are trying our best to reduce its effects. So the medicines they gave actually are mainly the antiviral drugs like the oseltamivir. They gave the HIV drugs. They gave azithromycin, the antibiotic, and definitely the most talk about medicine right now, the anti-malarial drug, the HCQS, hydrochloroquine. So these four combination of medicines were given to the patients in SMS Rajasthan, and almost 90%, more than 90% of patients convert from corona positive to corona negative. There's also a plasma therapy trial which is going on around the world, especially in European countries. So that is also coming up. There's still no vaccine of corona. There's a lady, she works in Oxford. She's actually a scientist and a vaccinator called Mrs. Gilbert. She has 2 or 3 days back, she has announced that they have developed some kind of a vaccine that might be available from September to October market, but we still have to confirm those trials. but we still don't know if the vaccine does this virus, the gene mutation uh, might these vaccine might not be effective that much. So we still have to wait and see how the virus develops, as well as the vaccines. So actually, right now we only have one solution. The prevention is the cure. If we wash our hands, if we apply the mask, if we don't spit in public, if we maintain the social distancing, the physical distancing, we hopefully we'll affect and we'll all be away from this virus. So that is the main thing. The government are doing their best. The doctors are doing their best. The lockdown has already been stretched. The second phase of lockdown is going on. So we all have to cooperate, the authorities, the government, and hopefully in the coming month, I'm expecting things would be better because the temperature has increased. So the virus virulency will definitely be decreased. The rate of transmission will fall, hopefully. So hopefully things will be better. Back to Sumit.
All right. Well, that was very informative, Arun. Thank you for your insights. I'm sure there will be a lot of questions will be coming your way.
Yeah.
Now we move to our next speaker, Ms. Sheenu, she runs a chain of hospitals in Jaipur in Rajasthan. Sheenu, it's over to you. We're looking forward for your insights. Thank you.
Thank you very much. What exactly is it that you would want me to focus on? What aspects of this problem?
So majorly, ma'am, as I feel the topic being how can, even if the lockdown is gonna get over in, let's say, a month or so, whenever it is. So the organizations are gonna get start. The workplaces are gonna get functional. So what are some prevention measures or what are some steps which people can take to, that is all.
So basically, I think that you can divide organizations into either they are of a manufacturing nature, or they are service related, or then they cater to people, as in they are service related, but they are retail. So the people on the provider side are very few, and people on the people who want to come and take the services are very large. So your strategies will be different in these three different scenarios. If you're a manufacturing industry, then definitely you have a lot of people and you can control them because they're working within the organization. And then we have to look at what are the various ways in which we can either provide them social distancing within the organization, or we can increase the preventive measures so that they do not catch the infection. If it is a service industry, then you have a mix of people who are on the provider side and who are coming to avail your services from outside. So when somebody comes to avail your services from outside, then you do not have much control on them. And the third is the most difficult, which is the retail industry. So you have a lot of people coming in from outside and you do not have any control over them. Depending upon the kind of organization that you belong to, you have to work out your own strategy. Now, strategy is going to be divided into either prevention, which will be building up community. It will be not having the entire workforce coming all together. It will be social distancing by way of, if it's a machinery, you cannot really change the location of the machines if it's a manufacturing industry and have people work on different machines at different times. That's not possible. So perhaps you will have to look at strategies which make your entire workplace sterile at best as it can be. If it is the office space, it's manufacturing, but it's also the office space. Perhaps you can have different people coming in on different days, separate out what is the most crucial work which has to be done. In this crucial aspect, who are the people who were at home but not working from home and they're eager to provide help? Who are the people who were working from home and therefore they can still be left to work from home? So you'll have to divide your workforce. All of these things have sometimes organizations with all of these things, they have a mixture. If I talk about the hospital scenario, there are the nurses and the doctors who are at the forefront, right? So that is almost like retail. If I talk about the back-end jobs, that is almost like a manufacturing. So you have a lot of people coming in and working. And the service side, of course, in each and every industry, there will be a service side. Either it is at the crossroads of having clients coming in, your vendors coming in, your shipment going out and coming in, So all of these different things you will have to place differently. We have been talking a lot about work from home, and now that's going to become the norm. But we have to understand that so far, whatever work from home has happened, there was no accountability in it. So there was hardly any work happening. There was hardly any demand. So people were just fulfilling either accounts works from home, or they were just fulfilling little crucial tasks which had to be completed because there was a sudden lockdown. But when the work starts happening in full swing, once the lockdown is open, and a lot of pent up demand has to be serviced, then work from home is not going to be possible for three reasons. Number one, you have to build in accountability of people who are working from home. How do you do that? Number two, unless or until you have the proper technology where there is a login time, logout time in certain core areas for which the people are working from home, you cannot really monitor their work. And thirdly, there is a lot of aspect of mental wellness, which kicks in when you are spacing out your travel to and fro home. You're meeting other people, you're interacting with them versus staying at home the whole time. So that's another aspect that we really have to look at, because it's not going to be an extrapolation of what has been happening in the last 15 days or 20 days or 1 month. The scenario is going to be completely different. This scenario is not going to get over in the next 15 days or 3 months. I think we could easily look at this entire scenario in a phase out position from now, or let's say end of or beginning of May until the rest of the year, at least till December. There are a lot of things that we can do for different kinds of sectors. And I think I would like to take those questions from the people, because they could represent different things and I could be talking entirely of different things. So there should be a match between what the people are expecting from this session and what kind of solutions we can give for different queries. So from my side, it'll be going back to Sumit and then opening it up for Q&A.
Thank you, Sheenu, for your insights. We will just go to the Q&A. Before that, we have got our last speaker for this session. So let me just introduce Sheesh here. Sheesh, I've done the introduction earlier. I'll just reiterate that he is the co-founder of Beehive Co-working Spaces in Bangalore, which has around 14 co-working spaces, and he hosts more than 250 companies. Now, that really gives an interesting waiting for interesting insights from him, because it's not just one organization he has to cater to. There are 250 organizations which he has to cater to. So really looking forward to what she has to add. She's over to you.
Sorry, yeah, I think I was muted. So cool. Hi, thanks. This is Shesh. So basically I'm joining from Bangalore, and so Beehive is one of the largest. We are also the oldest co-working space of Bangalore. We have about 14 properties running across Bangalore, and so currently we have about 4,500 desks. About 230 companies work out of Beehive. So I think I'll probably cover more in terms of what does it mean for workspace, and what are the actions that we are looking at, and possibly some of the things that we may have to explore as well, right? I think hopefully that is of use for Himesh as well. I think some of the things I would say is for us, we had already started some set of action just before we went into lockdown, because already the whole Corona thing had started, and so I think lockdown, if maybe 22nd or something it started, but at least I think 10 days before that, a lot of things were happening. So it already started taking action, and what I see is that it has to increase even further. So if I want to kind of see what is the flow of the overall people that needs to happen, right? I think one is, a lot of times there is a misconception, or when we speak about co-working space, a lot of times the thought process that comes to the mind is like, hey, people hanging out, people like sitting all around each other, etc. Right? So I think that is what, like, say, we were kind of promoted a lot, that co-working is like a very collaborative environment, etc. Whereas the fact is that, I think even though there is a lot of collaborative environment, it is mostly, I think, at least I spend almost 95% of my time at my desk itself. Ultimately it's, it varies, to an extent. I am a kind of person, honestly, I have my breakfast, lunch, dinner, all three at my desk. Maybe I'm on the other side of an extreme, but otherwise I think social zone, even though it exists, it's not a mandatory part of the whole game, right? So I think that's a misconception. I've seen a lot of people on social media telling that how can co-working spaces exist anymore? It can no longer work. Honestly, how it is like asking how can offices exist anymore, right? I mean, it's really not possible for everybody to be working from home for like next 2-3 years, right? I mean, people have to be coming back to office. So office is important. So I think in terms of, so what we have to make sure is that how can it be made safe? At least can we make as safe as possible, right? I think nobody knows once we get back, take all these precautions, things may again come back, and people talk about W-shaped curve, etc. So we don't know, right? So we can't do anything about what we don't know, but at least we can focus on what we can do, right? So to start with, what I would say is that thermal screening is something that's, I believe it is becoming mandatory as well by whatever circulars I saw. So I think these touchless thermometers, that is important, that everybody's temperature will be monitored and people will be allowed in. And obviously it is not 100% foolproof, but it is just like, I think it is only reducing the probability of somebody who has corona coming in, right? So that is something that will be done. The other thing is, I think now other part is, now I'm going by how you enter the office, right? While you enter thermal screening, then you have got biometrics. So I think the most suggested term right now is biometrics. Don't make it a touch biometric, use access cards, right? So that it is touchless. So I think that is something we are implementing everywhere. After that, now you need to honestly, you still need to touch the door handle. So what I would call that as a high frequency point, honestly, I think also the lift buttons. So there are a couple of these points which are impossible to make it touch free, or extremely difficult to make it touch free, right? Super expensive to make them touch free. So you need the lift buttons, you need the door handle. When you go to toilet, you still need to touch the toilet doors. So I think we are identifying all these high frequency areas, and we are planning to have stickers on that and separate SOPs for them so that they are cleaned at a much higher frequency, right? So the high frequency touch points, including, for example, the coffee machine buttons, right? These are things that will be there. I'm not going to shut down coffee, right? So I think that is something very important. The other set of it is, now that people have come, now that they go to their desk, we expect that people monitor how they behave within that, right? People have to, the warning should be there that people have to manage their own social distancing, don't form crowding, manage social distancing. Now the question would be, should people wear masks within the office? That is something I don't know yet. Honestly, I would wait for the regular practice. And I think once things open up, doctors, and I think I'm just hoping that things will form. I would not try to push people beyond what is regulatory requirements, at this point, right? Should people be wearing masks while they're sitting at their own desks? I don't know. I mean, I think these are things that will take some time and we'll figure out. The other things that we can definitely, which we are doing, is the social zones, right? Where people crowd, right? The games area with foosball, table tennis, pool, etc. All these places have been shut. I think they will continue to be shut for a while. And the main social zone, which will still be kind of functional, will be the cafe, because people need to come for food. We are considering making it very restricted. We don't want crowding to happen in cafe. So one of the things is we are considering encouraging people to have food at their own desks. I lived in New York City for a couple of years, and I know that eating at desk is like it's the most common thing there, right? I think like 80% of the people, they probably eat at their desk. So it appears like something that is obviously doable. But that's not a common practice in India. And I eat at my desk, but I think it's a very rare practice. I think that is something that can be practiced so people don't crowd. And the other thing is, events I don't see happening for a long time. Maybe Zoom based events is what would happen. There is not like really much events, etc. happening. Any large meetings, we have to be very careful how they are, allowed, and maybe there has to be exception taken to do any large meetings, and we need to make sure that all the processes are followed. Other than that, I think coming to work, I do see challenges is public transport is not there. So the taxis also, whatever rules currently, if you may be, I'm sure most of you are aware, is that either a car, only one person who drives it comes, or to maximum only one more person can be picked, that person has to sit behind, right? So these rules have to be followed. So pooling, all that is difficult. So transportation itself is difficult. I think some of these will invariably lead less people to come to office, I think, to an extent, which may help the social distancing. So other aspect would be for employers, identify who can work from home, let them work from home. Maybe they come to office a few days a week, or you alternate it. That might be a practice for some time, so that every desk is not occupied, right? That is possibly also something people are looking at. I think I've covered. I think other point I had was, for example, water is something I don't think we should have reusable water cups. We basically at Beehive, we gift water bottle to everybody, and we tell them you clean it yourself. I think that's a good practice. People have their own bottle, they fill it up. We have mineral water, they fill it up, they go back, they drink from their bottles. The other big question a lot of people have come up with, how is the air condition thing? I think that has been the most difficult to implement because we are actually, like I said, we were running before the lockdown where, people were worried about Corona at that time itself in Bangalore. So there were AC we were trying to implement. We said, hey, we won't run AC because that's what the government was saying. But there were a lot of customers who were like against it. Like, I want AC. How is it possible? So I think that is going to be, because all our property is designed to be centralized AC. Now maybe we have to run it like a few hours, shut it down. Actually, that's what we did. Then we did alternative hours, etc. Because obviously I can't keep fighting with my customers. So I think there is a tricky part there, because a lot of people talk about how do you increase your ventilation, maybe clean the AC filter cleaning. Can there be better filters? Honestly, maybe, but I think because everything is shut down, nothing is really, I don't know what is going to come up in the market. So I think the air filtration system, how does the ventilation work, especially properties that are designed to be central AC, centralized AC, there would be a logistical challenge to figure out. I think that's something I'm not very sure how I would handle. I'll have to figure that out. The other part would be, good thing is in my property, honestly, I think one of our design aspect is, even though there's AC, there's fan everywhere. So I think that has been a good design, because we know we don't run AC for 24 hours, right? But center is open for 24 hours. That's why I designed that way. I think that is going to come in a bit handy right now. Other key aspect, okay, it would be, I think, how do we handle visitors, right? Visitors to my customers. That is something where we have to be little, it can't be as open as before. There were mass interviews and all people used to do, and there were so many different things. I will have to come up with a much stricter guideline of who is allowed, how they are allowed, etc. Obviously thermal screening goes for everybody, but possibly slightly more careful, and they have to follow the guidelines. Members are somebody who stays with us, so easy to educate them of guidelines. This is what you have to follow, etc. And a visitor, let's say somebody is not as educated, or comes and violates all these things, you never know, right? It can just spread to everybody. So I think we had to be very careful. Other aspects I would say is definitely, I think we'll be on tender hooks as a co-working space, because we don't know when our wards will become declared as hotspot or not. I think these are general business challenges that I'm aware would come in. We'll have to generally check with our own ward and all, how the declaration happens, etc. But these are some of the high-level things that I can say. I think there are, honestly, in fact, actually, we are coming up with our own SOPs, documents, and there are circulars, there are notice board for customers. There are emails going out to customers. There are things that are coming out on notice board. There are things that are being, like, all our staff, housekeeping, everybody is being trained on various aspects. And of course, I think everybody has been given N95 mask as well. All our housekeeping, security, etc. They have been asked to use gloves for doing a lot of activities. So it is important that we enforce all these things. That also is not very easy. Our supervisors are being trained. So there is a lot of work around these.
So to add on to a few points which Sir said, because I come from a similar background. So what I have figured out, and some innovative ways which can also be incorporated in workplaces. So for example, when it comes to attendance, so there are some companies working on facial recognition based concepts. So basically the camera surveillance which are already installed in the workplaces, they can recognize that whoever the person is present, or some GPS based apps which can track the location and let us know that whoever the person was present at that particular place. So that is how you can help get attendance. Then second very innovative and cost effective way is, again, so like as Sir told, the most frequent places like taps and all that. So that can be used by tapping your feet. So for example, if you want water, there's sort of system incorporated in the already used tap, that you just need to press the button and the water will pour out, or the sanitizer will pour out. So these are some of the innovative solutions which big workplaces or office spaces or big co-working spaces might have to incorporate in their existing systems to make the places more sanitized and more risk-free, which I feel. And then over to Sumit sir to have Q&As and all.
Yeah. Thank you, Sheesh. Thank you, Hamish, for adding. Yeah, I think we are definitely looking for a lot of innovation in how we really play in our workplace. Really, I think a simple toothpick can also be a good way of going about of the places where we have to actually press, whether it's an elevator or whether there are a lot of places where we actually have to press. So a simple toothpick can actually avoid probably going for that distancing part. But anyway, I'm sure there will be a lot of innovative ideas coming up. Just to summarize what has happened till now for our attendees, I think I have got 5 points which people have really mentioned, all our panelists. So the first one is about we must avoid mass gatherings and large congestion inside workplaces because that is inviting a lot of trouble. Second is we obviously have to double down on our hygiene practices, starting from very basic practices about getting the place sanitized, doing exhaustive cleaning, making people aware about it. The third thing, which is another very basic thing, but important because you tend to miss out when you are with your folks around, your friends around, with social distancing. That is something which is very important while you're working. Uh, Another thing which I just wanted to add from my side is that probably a self-protection kit, which is your own small kit which you can create at your home, probably with a sanitizer, small sanitizer, a refillable sanitizer, or a mask, tissue paper, which is there, probably which you can carry along with you whenever, wherever you are going, and you can use it in due course of interval. And the last thing, which almost everyone has mentioned, is about going digital and going about virtual collaboration. So these are some of the points which I could really note down, but it has been very informative about this thing. So I we have already started receiving some questions. Before that, I'll just go to the first question, which is by Nikhil. It is directed to Dr. Mathur. Dr. Mathur, he says that how will COVID-19 affect the hotel industry and banquet events? And can government impose some restriction on this for a long or short term? So if you've understood.
Yeah, I think the hotel industry is actually hit the most by this COVID. Many hotels have been completely shut off, and I don't see in the next 3 to 4 months the hotel industry getting back on track. At least not for banquets. We might see the restaurants in the hotels to open maybe when the cases decreases, but I don't see proper the banquets and the full hotel sold out things. I don't see in the next 3 to 4 months. It's until we have zero cases of corona in a state. I don't see hotel industry getting any benefits.
Okay. Okay. There is another anonymous question which is there. It's for Shinu here. Ma'am, he asks about that uh, in in this entire segment which is there wherever we are working, uh, how to really create more awareness about COVID-19 so that people really follow the norms, because probably we Indians tend to break the rules very easily and tend to miss out on very basic things, starting from spitting, which is a very common thing which you go to government offices, you end up seeing that thing happening on all the walls. Uh, so if you can share some thoughts on how we can improve the awareness levels.
Yeah. I think the first thing, which is very, very important to understand, is that no matter what we do in terms of prevention, if our immunity is good and if we are healthy, then there are so many germs anyway roaming around. All of us have not been afflicted with swine flu or dengue or SARS or Ebola. I mean, whichever part of the world that it was in. The most important thing is to build our immunity, and everything has to start from there. How do we create the awareness? I think if we are just very careful about our practices, we are going to influence a little circle of people whom we regularly interact with. Some of them may be cynics and they are not going to listen to you. They're anyway not going to listen to you if you tell them things, but if you are going to practice things and stay healthy, then I think it's a live example that you set in front of others. So let's not begin with the world. Let's first begin with our little workplace, our families, our neighbors, our colonies, our apartment complexes that we stay in. And I think that is a start. If you continue to stay healthy and pass through this time, and I think, and with your with the way you conduct yourself, that should be a good example. There are just a couple of things that, with your permission, if I can say them.
Sure, sure, please.
In workplaces also, there are a lot of people who wear work uniforms. But the norm is that they wear their work uniforms from home and come. So that is not the purpose of wearing a work uniform. So if we can set aside a little change room where people who have work uniforms can change into their work uniforms from their street clothes in that place, you ensure that your workplace is clean. If people are allowed to work in their street clothes, even if we can give them a little apron, if at all, in the first 3 months at least, we ensure that people are going to be covered and their street clothes are not, there is a social distancing, so to speak, from the infection that you may be carrying from outside. Then if we can have a little wash basin right outside before we enter the office spaces, then we ensure that people are going to wash their hands. So again, even if you want to create awareness in your workplace, things will not happen if you harp about them. But if you create these little touch points where people are forced to wash their hands and then come inside the office, if people are forced to change their clothes right there and then come inside the building, then the DNA will start altering and it will become a part of your habit. The third thing is that, again, to create the awareness, can we set an example by ensuring that at least biannually we take the basic health checkups data of our people, we get those done, whether we pay for them or the people pay for them. In the given scenario, I think everybody will be very happy to get their health check done. We do not have to get a very extensive health check done, but a basic CBC is also good enough to know if your WBC count is very high. It shows that you have carrying an infection in the body, which is not getting shown, but there is some infection that you're carrying. So that is very important. Maintaining a digital health record of your people is very important. And lastly, apart from the biometrics that we have just discussed, two other points are your eating area and your bathrooms. So I think very less attention is being paid to these two areas in any organization right now. And normally what people say is that if the owner of a business or the top management is able to sit and eat in the same cafeteria or eating place, apart from your desk, I completely agree with what has just been said. But for those people who still would like to set out and eat, and if you can use the same bathrooms that they use, you will ensure that they are clean all the time. Because even scientifically speaking, COVID does not just impact from breathing and the droplets, but also from the use of the bathroom. So that area also has to be kept clean. So apart from the awareness, I would say two things to sum up what you have asked me. The first is self-conduct and trying to influence a little circle of people around you that you can impact. And the third is by setting an example rather than by just talking.
Sumit, I'll just come in for a minute. See, very correctly placed by Shinu over here. See, when this COVID started in January itself in our offices, global offices, we introduced two things. One was hand sanitizer and one is infra thermometer, which Shesh has just highlighted. So we started implementing it, and every time the employee was moving in or out, every time the temperature was getting checked, monitored, and even noted. If any of the employee was running temperature, then he was immediately asked to leave the premises, whether or not he was under influenza or any threat. But as soon as we detect, we didn't allow that guy to enter inside. Now, very correctly said, the facilities, they have to be very, very cautious, and there has to be a standard operating procedure. Now, I would like to give a synergy. In hospital itself, they have a standard operating procedure of disposal. Now, when we say N95 mask, okay, we can provide to each and every individual coming to our office. But what is the mechanism? How this mask to be disposed? Is there any standard operating procedure which hospitals were following, but the workplaces has to now follow? Because again, it is an infectious component. Shinu, correct me, if you have standard procedures for the disposal of all medical medical waste and all such equipments, you're already following it. This has to be copied into the workplaces now.
So I completely agree with you. And in fact, whenever I have come across anybody that's like a common layman who's not working with a potentially infected person in a hospital, which is completely engulfed in various kinds of infection, not just this, I have told them you do not need an N95. What you need is a cloth mask, a 3-ply cloth mask. The purpose of the mask is so that we are normally in the habit of touching the various parts of our faces. And the mask stops us from doing that. So while we touch each and everything with our hands, it's not possible, like somebody said, you can't make everything touch-free. The lift has to be there. You can use your elbows, but you will end up touching things.
True.
You put those same hands without thinking, as the practice has been, to your face. And the mask is simply a barrier for that. Now, while you can wash the cloth mask at home and dry it, a hospital takes these N95s or the disposable masks and disposes them off in the correct colored plastic bags and sends them off to the correct agency for the final disposal. So there is a system which a common layman is not going to be able to do. Correct.
And the problem is during the time of H1N1, I think it was before 4 years, 3 to 4 years, more than 8 years now. So we followed this procedure, and it was a scare, totally scared. So there was a psychological impact. Employee was not willing to come to our office. And at that time, there was no such mechanism also. Like we have number of components now that we can sit and operate from home. So earlier, before 10 years, it was becoming a real scary to bring an employee mentally to workstation. So this COVID is much more than H1N1.
The rate of transmission of COVID is very fast. Actually, it's faster than H1N1.
Akshay, I'll just like to chip in. I think we have a question for you here from one of the attendees, that so how do you really motivate the folks to go back to the office? How do you motivate your employees to go back to office? Because for a lot of organizations, work from home is working perfectly fine, at least for the internet-based startups or the organizations which are heavily dependent on technology. So how did you go about? Because you, with so much experience that you have, there have been past events also. So if you can just shed some light on that.
Okay, see, we don't have any challenge right now with respect to PPE, we call personal protective equipment. The process we followed in the field, because our people used to carry the belts, etc., which we call PPE, and they were completely guided and certified for occupation health and safety. Because working at height itself needed a standard operating procedure and the personal protective equipment. So there is no threat. What we are doing in the field right now is, instead of sending 4 people in one vehicle, we say you take 2 vehicles, though it is adding to our cost, but definitely we have to protect our people on ground. This is one part where, yes, we can do something, but again, the workplace is becoming a very challenge for us. We manage somehow with hand sanitizers, with temperature monitoring, but the scare has gone to such a level now that it will be very difficult to bring more than 30% to 35% staff. Because if I am carrying a seating capacity of 1,000, I can bring in only 300 or 330 people at a time, which Shesh can also come into on the dimensioning aspect. Now, who will be these 300 people who cannot work from home? They are required to be in office. Now, this can be your facility staff. It can be the staff whom is required to do physical signatures. So we have gone away with physical signatures also now. We are carrying a disclaimer in all mail communication with our ASP vendors that due to this reason, we are approving your GRNs, we are providing you POs, and you have to submit work completion certificates, which has to be digitally signed. So to that level, we have gone. Now, again, the challenge is how to open up. After 3rd May, how to bring people. Because see, every home is not 3 BHK or 4 BHK. There are people who are living 3 or 4 people, 4 engineers living in one space, 1 BHK, because of the cost or because of their natural requirements. So how we can ask those people to create a social distancing, and when they are coming to office, how to ensure that they are mentally secure, they are not worried. So this is
Absolutely,
becoming a
absolutely.
challenge. This is where the standard operating procedures are being created. Our team, the crisis management team globally, is working on this aspect, and soon we are going to release it by the month end. How we are going to have it. So by the time we have it, definitely as a multinational, because it's a global pandemic situation, definitely when it comes, I'll be most happy to share this with the industry.
Sure. Okay. Sheesh, you have got the next question. Sandeep is asking that so while we may expect some companies to offer co-working spaces to reduce the fixed cost uh, and obviously have the additional amenities with them, uh, but how will you make sure that you're able to give that customized space in your existing space so that they have got a designated area? And there's another question which I'm just clubbing with this thing, that how is the office layout for a particular uh, organization inside your co-working spaces going to change, or how will the overall office layout be changing? If you can answer this.
Okay, yeah, thanks. Basically, I think there are two things. One was two parts of the question, right? One is about
Yeah,
how can people get their own designated customized space?
correct.
Other thing is there an impact on the design of the space itself to prevent or to encourage social distancing, let's say, right? So I think these are challenging parts when it comes to co-working space or any office, right? To be able to reconfigure the layout, honestly, is not the easiest thing here, because if you would see, it's like a theater, right? I need to be smart enough to have enough seats there, right? It's only one screen. How many seats are out there, right? So, or a restaurant or a pub or anything you go, these are all people business, right? So we have made sure that the design is such that there are good amount of people that we can have in our space. So provides a significant challenge to us. One is in terms of being able to provide customized space. That is something, it is actually, I think it varies from co-working space to co-working space. In our business model, people can take space and design. It's like a chessboard. I tell people, you select how many seats you want. Then you kind of design how, like, let's say you can select a 50 people area and you can ask for 20 people. My charge will be based on what you selected, right? So there are a lot of people. For example, Google has 100 people area, but they never come more than 20 people, right? They've customized it. Google is one of our customers, so that is definitely there. So the freedom for the company is always there to get it designed the way they want. That is very specific to how we operate, because I have a 10 people interior team myself. So now I don't know if every co-working space will be able to do that or not. So I know for us we can do. The other part of it is also, I think the another decision we had made, which I think can be useful now, is that we moved away from open areas to private offices, right? And we realized that in India, private office is what everybody wants. I actually came from New York before starting this, so open work area is very common there. I realized in India the behavior is very different. It took a year or two for me to realize that these open areas are not going to fly, right? So every company, they're open to have open area for within their own company, but they don't want too many different company people to sit with them, right? That's the whole. So if there is I have a one company which has 300 seats. Honestly, all three are open, but technically nobody else can get into that area. But whereas if 10 people, company come, they will have 10 people area. So that is something. I think that model will actually help, I think, in this situation, because companies will feel like, hey, I can control my employees. I want my area, right? I will control what happens within this. So that is one part of it. Other part of it, I think, redesigning the space itself. That is something. So we have very, very standard way the space is designed, in terms of we have a very simple layout, all like, flat workstations, linear workstations. The only challenge I see is right now the way the airlines and all people are talking, right? Sometimes they're saying maybe the middle seat is unused, etc. And in fact, I was in a conference with Aditya Ghosh, my investor Bloom had arranged. He was saying that's absolutely unviable. If you remove the middle seats in the flights, the cost will be so high, people won't be able to pay. And so there are a lot of other business side arguments to it. Whether they will do it or not, I don't know. In our case also, it's the same thing, Now, how long would you kind of make these alternative seatings, or how much distance can be given, etc.? It's not very clear. I think the only thing, as I said, in any case, what is going to happen is for some time, whoever is going to come, not all their staff will end up coming, you know. So that will itself lead to a lot of social distancing by default. Other part, again, it's very specific to Beehive, is that we recently launched few properties. So they are technically empty. You know, a property takes 6 to 8 months to get filled up. So I have what at least we are thinking of is, because we just started few properties that have so much space, can we redistribute people across? Tell that they move to another location, and so that I can have a lot of distancing, right? So that so I think that's something, again, very specific we are looking at. Also, honestly, the fact remains that a lot of companies are going bust, a lot of layoffs are happening, no matter what the government says, right? The economy is in a tough shape. And so I'm easily expecting 20 to 25% of business to go away straight away, right? Because of, again, it depends on the length of the lockdown, but so many layoffs, so many things are happening. So space is getting created by itself, by default, which can somehow be used in some sense, some redistribution we can do to help social distancing. I think these are all the thoughts that I have, but I think once we get down to action, once we are allowed to operate, you know, or I would say once there are enough customers coming in, we will figure out how to actually implement these.
Sumit, just to add on, what we discussed, you know, as a personal protective equipment for outdoor, for workspaces also, for protection, personal protection equipment is required, and there is an opportunity sitting as a business. So if any of the startups who are looking into this aspect, who are listening as a participants, they can come up with these solutions. Like a simple example of the mask disposal, and at the same time, there are so many things how to clean your air where you are sitting. Though there are 30% people who will be operating, and gradually will go to increase those numbers, but how to make that air healthy to operate for those 30% people also. So there are opportunities which are sitting, and this was the main theme why Himish has brought us together, to bring as a threats and convert it into opportunities. So as a telecom professional, I'm also looking into some aspects where there are startups whom we don't know, and if from one domain they can carry this information to another domain. If one domain or one industry is using it as a personal protective equipment, can it be brought to telecom also? Like hospitals, how they are doing it, standing operation procedures, can they come to telecom and to the co-working spaces? And even houses, in houses, none of us are maintaining social distancing, are we? No, unless and until one of the person or a member gets into this, then only you'll say that other people will go into isolation. So what PP we are following at home? Varun can answer this.
I think we don't have to, keep physical distancing from a asymptomatic person. In our houses, our family members, if they're not going out, they're asymptomatic, means they might not be the carriers of corona. So only when we go outside, we don't know if someone is symptomatic or asymptomatic, and if he might be carrying the coronavirus. Then only we have to keep this social distancing and physical
Varun,
distancing.
I'll interrupt over here. If I am going to office, okay, after lockdown, I'm coming back from my office to my home. I don't know whether I have caught it or not. Okay, it's a hypothetical question, but you may answer this. That how to do this temperature checks at home when as an employee I'm going outside, because I'm moving outside.
Yes, but when you're moving outside, you must be wearing a mask. You must be washing your hands. You must be keeping the physical distancing when you're going to your office. Your office employees, the colleagues, they must also be using the mask. They also must be using the sanitizer. So we are expecting, then if you're going out, when you're in the social area, you have to keep these 6-7 steps in your mind, that you have to be away from them. So if you're using that, then there is very less chances you'll be bringing the virus back home.
All right. Varun, the next question is directed towards you. There's no name, but the person is asking that, so he's a manufacturer of cotton masks, which are according to Government of India guidelines. He's asking whether these typical cotton masks are effective enough in public places?
Look, cotton masks are good. They're definitely not effective as N95, but they are good in a sense that they are reusable. If you wash by yourself and you can reuse it. But definitely they are not, the potent as N95, but N95 also we can use only for 6 to 8 hours. Then we have to again wear another N95. So the good thing about this cotton mask is they are reusable. So if the person, as he has told, that they are manufacturing, they must contact the government. And actually, there is a lot of scarcity of the mask in India right now. A lot of PPE, the mask, they're not in the hands of doctors. So even if they are cotton masks, and even if they are given to the all the health workers, it will be a boom for all the health workers.
Okay, okay. There's another question which is there for Sheenu, ma'am. So Abhishek is asking, what do you feel about social distancing in an office setup? And do you think the education institutions and how will they approach this particular problem?
Sorry, your last part was not audible. How will the education institutes approach the problem, and then?
How will the education institution and hospitals address this problem of social distancing?
See, personally, I don't think that after the 3rd of May, world is going to come back to how it used to be. I don't think that's going to happen. Already, we are expecting a lot of disruption. I think, if you ask me, let me first answer this question specifically and then meander into my thoughts. Education institutes are not perhaps going to open immediately after the 3rd of May. I don't think that it's going to take a while. Even if that happens, you can't stop a class from taking place. The only thing that you can do is you can perhaps space out, you can make more sections if it is a school and accommodate lesser number of students in one area than you did earlier, correct? But you can't stop schools from happening altogether. You could alternate and you could call half the children, or whether it's a college or a university or a school, to the classrooms, and half could be online. And that's how you would have to split up if you do not have enough infrastructure to cater to everybody in separate places. In a hospital, again, the surgeries which can wait are waiting. It's only the surgeries which cannot wait, they are happening. So we are anyway running on a 30% occupancy as opposed to earlier. You cannot stop a patient from coming to the hospital, but I'm sure the attendant policy is going to change. You can't have the entire family coming in to meet the patient because of the social norm. So the social norms will change. People will not want to come to crowded places, least of all to a hospital. So automatically, because of the mindset, things are going to change. We will have to look at each and every business in terms of how people are going to behave in future. I think a lot of migration will stop. People will not want to move out of their villages or cities to look for jobs outside, because health will become more important and survival will become more important over the course of next 1 year. Then getting a better job opportunity or a salary is going to be. So we will have to, again, we do not have all the answers to this right now. This has only just happened. We will have to adapt ourselves very dynamically to the way people are going to the communities, the way communities are going to think. Because now we cannot talk about individuals. We have to step out from this perspective and start thinking about public health, how communities are going to behave. And again, different communities from different states and different mindsets are going to behave differently. So to be very honest with you, I think the next 3 months will be crucial. There will be a phasing out of the services getting together. Perhaps you will not see any weddings and banquets and trainings happening where a lot of people will be collecting together. And then, of course, I think we will have to be prepared to see how things happen. So this 1 year is going to be very crucial, I would say. And as promoters or as business owners or as leaders that bring about change, we will have to be very dynamic in our approach to how we deal with all of this while making our businesses work. And of course, ensuring the workforce's mindset and safety.
Sure. Okay. Thank you. So we have got time for around a couple of more questions. So there's another question which is there, which is directed towards Mr. Akshay, since he comes from a telecom background. So there's a question which is regarding the privacy issues which are going to happen. One, because a lot of technological interventions which are coming, and last week only government of India mentioned about how Zoom is not a very safe place to do conferencing. But I mean, there are very limited alternatives, honestly, with so much of ease which we can work with. So, what is your suggestion on this matter?
Yeah. Okay. See, before this pandemic, and we have this Zoom coming up into as a social media in offices, we were told to use only Skype. And 4 days before also, we have a global communication coming from our headquarters. It says, please do not use Zoom. You have to use Skype and other means of Microsoft and Google, which take too much care on the cybersecurity aspects, because they are the institutions who are doing a good job on this aspect, cybersecurity. Before commencing this workshop, I had a discussion with Himish also, because see, there is a government of India which has given that this is a threat. Even Rajasthan government has brought up into this. One of the local newspaper, Bhaskar, has brought this aspect. And we have a communication, what I just expressed, that from our headquarters also. So I'm using my personal laptop because I cannot use my official laptop because there is a mandate not to use Zoom. Okay. So this is the thing. But I have signed my IT disclosure and IT safety rules. If I have used Zoom on my official laptop, if it gets recorded, I have to lose my job. So gentlemen, be very particular about it. Since you are working with an organization and there are communication which prevent you of using such gadgets or such applications, don't use it, because they have the authority and the right to discontinue from office. So this is my humble request to the people. Since it is a telecom aspect, I'm just elaborating more on that. So as a professional of after 25 years, I have that fear that I cannot use my official laptop for this call. It means something. So it's very serious, and people should abide by it. And it's not only that it's individual choice. As a country as a whole can be a threat. Everything is getting recorded, and in today's world, the digital data, you don't know where your data is being used. Even when you're typing your password, the person can look into your handset as a screen. It can be captured as a screen. So only encrypted applications have to be used. Be very particular about it. And this is equally when your workplace is providing you the gadgets. The authority or the, like Himish, he's running the co-working space. He has to take care of all these aspects. The cyber security is going to play a major role. And with coming of 5G technology, when doctors and hospitals, when they'll be using it for the robotic applications for surgeries, still there are norms which are getting created. Why 5G is not coming as 3G and 4G has come into the country? Reason being, there are aspects, hidden aspects, which has to be taken care. Otherwise, the person can go inside, create some subroutine which can destroy the robot, or it can even kill the patient on the table. Okay, so another aspect is that 5G is a speed. Again, we have to work on the latency part. Like sometimes you get glitches when you are into Zoom. You must have observed that there are glitches. This type of glitches cannot come when the patient is being operated. So telecom has to be so secured that even a 1 bit or 1/10 bit of the information, when the patient is getting operated, it goes haywire. In place of heart, it can go into liver. It's a just a joke I am telling. कि अगर आप हार्ट को ऑपरेट करने जा रहे हो सकता है कि कोई लीवर को ऑपरेट करना शुरू कर दे या कोई बार्जिन कर जाए. ठीक है. So looking into all those aspects, the cyber security is creating a threat and it is being worked out. इस पे बहुत ज़्यादा काम हो रहा है, norms लिखे जा रहे हैं, standing operation procedures बनाए जा रहे हैं इसके ऊपर, and that's why 5G is being delayed, not only for spectrum reason, but you must have seen communication that is coming that in India, it is Huawei should not come. I'm naming the company, Huawei should not come because there is a threat. Government is underlining this threat. That's why the things are getting delayed. US is forcing that you should not bring in Chinese equipment. And you see in the pandemic case also, what the things are coming up. The Zoom application itself is a Chinese application. And we are using it. So there are so many aspects we are using it. But there is a fear, not only in government, there is a scare in the organization. We being multinational operating for almost 140 years in the world.
Sorry to interrupt for this. Even Indian government has released out the MEIT has released out a fund of around 1 CR. That if some Indian person can, make a video conferencing app, they want to grant around 1 CR rupees to them. So
yes,
I think such solutions need to be worked out. So great insights, sir. Great insights.
There's already an app which is there in place called Namaste, which is
Air Meet also, and like
Hygiene definitely has got funding also.
Yeah.
All right, we are approaching the end of this session, and we're almost exhausted with all the questions. I have got one last question, which is for everyone here, all the panelists. So yeah, we have been talking a lot about the physical infrastructure, the hygiene, the physical hygiene, our protective gears. The last bit is that how this entire scenario in your organization or people around you is affecting the mental status of human being. Like I'm sure there's a lot of psychological fear which has already gone into a lot of people. National Disaster Management Authority has started with something which is there in terms of an initiative where they are onboarding different psychologists across India. So just want to take your insight as to how the mental health can actually be also improved and after this lockdown is done.
Can I go? Can
Sure,
I answer
sure.
this? So incidentally, I'm a student of PhD. I'm doing PhD on mental health only, but this is for pregnant mothers while they are still carrying their baby. Mental health is not something which will have an onset suddenly and will get resolved suddenly because it's a chronic problem. We do not even know if we are suffering from a mental problem, sometimes for 10 years. I think the responsibility of a promoter or the top management in an institute is to most of the times keep up the morale of their staff. Whether we do it with psychologists or psychiatrists or counselors, that's another story. That's just a tool. But the first thing is the awareness, which you have correctly pointed out. The second is personal engagement. The third is talking, listening, finding solutions which are not generic, but sometimes they're customized to people.